Merci, Claude. Before I get into my presentation, I wanted to say a few words on the recent events in Japan. And as many of you know, Astellas is a Japanese pharmaceutical company. We, in fact, were the first Japanese pharmaceutical company to establish ourselves here in Canada back in 1995, and subsequent to that, we used to be able to say we were the first and only. We'll always be the first, but we're not the only one now. Over the last 3 weeks, I've received numerous emails and messages from you, from my colleagues, from suppliers, even from competitors, asking what the situation was in Japan. And I really want to thank you for all that. We actually passed all of those on to our employees in Canada, and there is a website that Astellas has established globally. And I can tell you it's very, very meaningful to our people in Japan to hear those things. And so thank you very much for all of that. And in fact, last night we had a couple of the Japanese executives from Isai and from Takeda at our office, and I was talking to them, and I told them I was going to be here, so I wanted to pass on their thanks as well for all the very kind words. So now on to something a little more sobering. So the first thing, I think we'll just jump into the first three questions because I don't have a lot of time. So first question, what does your current sales training focus on? Please answer the question. Okay, a mix of both product, therapeutic knowledge, and selling skills. So next question, please. What keeps you up at night? Decreased access to key physicians, face-to-face time spent with these customers, and how to best allocate your current sales resources. Interesting. Really about allocating current sales resources. And the last question. Looking back at your latest selling skills initiative, did you purchase an on-the-shelf program or customize it to your specific needs? Customizing it to your specific needs. So I've got an audience that might be interested in this. So moving on. I'll tell you a little bit sort of a background. Oops, go backwards. Sorry. That as a company, Astellas, we're a relatively small company. We really, from a training perspective, we still do not have a training department. We leverage our U.S. colleagues primarily for product knowledge training. And really our business model has been to go out there and hire experienced sales representatives. So what we always felt the need, or we didn't feel the need to go out there and talk about selling skills to people because we were hiring the selling skills in. We wanted to train them on our product. But what that sort of led us to, and certainly our sales and marketing team identified it pretty early on, was that everybody was coming in from a different company, and we all had different languages. The salespeople had different languages because we all get indoctrinated into a selling skills program specific to the company. And those of us, like myself, that have been around a long time, I can remember the first selling skills program I did was Xerox, and I really learned to sell bulldozers extremely well. Really didn't have anything to do with pharmaceuticals, but boy, they thought that was probably the best course to take. And I think the whole issue for us was if we're going to hire these people, and then now we've got a very competent sales force in terms of their selling skills. If we're going to introduce a selling skills program that's going to be relevant to them, what are we going to do? So this is really, so that the first thing was really about a common knowledge, but then the other one, and I think Brian Yan really talked about it, was trying to add value. And what is it as a sales representative that you can do day in, day out? Because if a physician is faced with two representatives coming into his office, we want to be that preferred representative. So what do we need to do to add value? And I guess what I'm going to present to you is not the answer. It's part of our answer. And I think the call to action, and Robin, you asked for a call to action. I think the call to action for us right now is to find how we are all going to add value when we have that short time with our customers. And that's really what it's all about. Because gone are the days of spending a lot of time with the customers, especially in the primary care market. So the vision was to build this relationship selling experience and really to pool best practices. So we decided to not go off the shelf. We wanted to design it ourselves, and really we wanted to build it so that we could transfer our best practices to all of our representatives within Astellas. And in terms of the methodology, it was pretty simple. We wanted to look at our content and processes. We did a lot of one-on-one interviews with customers. We went out there and the firm that we used to do this program went out and met with doctors to find out what it is that they were looking for from our representatives. And we really took that to heart. Our people, or the company, went out and did work with us, and we selectively picked our top representatives because we felt that that was probably the best way for us to learn best practices, and we also did some external industry research. Now, the interesting part of dealing with top performers is if you ask them what it is that they do differently, they have absolutely no concept what it is that they do differently. You really need to have that outside perspective, taking a look at this and letting them know that what they do is actually different than most other people. And it really takes a trained eye to do that. And that was really a big learning for us. So we came up with this model, and I'm not going to spend a lot of time on the model itself because I'm not here to talk to you about that this is the answer. This is one of our answers. And we called it the Improving Patient Lives model. And I know most of us in this room, this is what we're about. Our products, really, we're trying to improve patient lives. And so we really looked at it from this perspective, and we broke it down. So this is our relationship selling model that's been adopted across our sales and marketing teams. And really, the first part, the first pillar is insight, and it's really about the importance of translating that knowledge into increased business acumen. And then, for example, then we looked at each one of the elements within that and then came up with a number of criteria. So you can imagine each one of these side of those triangles, we did exactly the same thing. So individualized, hey, we wanted, every customer is an individual and they're unique and they should be dealt as such. And then here are some of the things from a patient awareness perspective. And it was just a drill down. And then finally involved is really that customer-centric approach. And for us, is very much that way. We're trying to make sure that we're addressing our customers' needs, not necessarily our needs. And we talked about unparalleled service in that involvement. So finally, we came up with this model. I'm glad to say that it was, we did put it across the sales force. Our marketing group did a phenomenal job in being able to incorporate all of their sales materials into this and try to give us a common language. So the first objective of trying to get a common language, I think we met. The second objective of adding value is really work in progress. And I think really, my final thought for you is really the call to action, is that I think as an organization, we have the marketing and sales leaders, thought leaders in this room, is we need to think about how we're going to add value to our customers and that day-to-day contact. And I challenge each and every one of you to come up with something unique and innovative, because if we don't, we're going to be out of the equation in a few years. So with that, I would like to thank Mitch and Joe for inviting me again, although I have no idea what I've done to you, Mitch, for being the last person. I know what I've done to Joe over the years, and it involves golf and bets. But thank you very much with that, and I'll turn it back over to Mitch.